people from the Black community have higher levels of deaths from hypertension and stroke, and they get stroke at a younger age. Diabetes in Black groups is up to 3 times higher than the white population, and we have more deaths from diabetes. And our men, they're 3 times more likely to develop prostate cancer than white men of the same age.
Affinity Xtra, be extra. Hey guys, this is Roger Moore here on Affinity Xtra, celebrating gospel music back at Origin. We're here on the Edge Show. We are doing an NHS special. And yes, we are tackling some of the issues with interacting with the community. Historically, we have struggles, and we're having people that look like us explain to us that, you know, we gotta access this. Our people are dying because of a lack of knowledge, literally in the community. And I'm very passionate about health and well-being. I'm very passionate about wisdom as well. You know, we are very much driven, and I keep on saying this, by social media. You think that's a great space to learn information, but it's a good job to listen to the professionals as well. And one of the professionals I got with me today, the super professionals, is I'm not gonna get myself in trouble. Is Bimpe? Okay. So I'm like, yes, I got it right. But on a serious note, she's been interacting within the community in London and within the Black community, and she can explain to us right now how she has done it and almost a bit of it why, because we seem to be always at the top of the list of suffering when it comes to stats and information, which we've seen on TV right up to this very day. Explain to us some of the, where you plug in and what's your role.
Thank you, Roger. I'm a public health consultant, and I guess basically the role we play is to try and promote the health and well-being of our population. So I work in Lambeth, which is a very diverse community, and I know that a large proportion of our Black community either live in Lambeth or come to Lambeth.
So we're coming out of a period of mistrust. I think social media doesn't really help things because bad news travels well. Let's be real. You know, bad news, bad experiences travel well. Good experience don't travel at all. I suppose your department deals with things like prostate cancer. You know, it deals with giving blood. One of my friends sat down with me and said about how much times we don't give blood. What's some of the comments that people say when you're trying to interact? Do you talk to them and they go, oh yeah, we'll be there tomorrow? But what do you think scares them? Or are we too busy? I don't want to come to conclusions. Is it that we're too busy, or we don't trust, or we just put our faith in God and just ignore it?
I think there are a whole load of issues that actually I probably need over an hour. And I think some of the issues were highlighted over the COVID period, where it was really clear. And we heard the Black community as well talk about some of the main issues that concern them and some of their reluctance, not just in terms of the COVID vaccination, but just generally the health service, as you alluded to. And what we've decided to do is, in Lambeth, is that we really wanted to respond. We've kind of heard what our communities have said, and we are really wanting to support the health and well-being of our Black community. We know that some of the health outcomes of some of our communities aren't great. And so we've decided to take a different approach from the traditional one, which we know hasn't really worked for our community. So we've held Health and Wellbeing Days for our Black community, and we've also launched what we call Community Health and Wellbeing Hubs. These are hubs within our local neighbourhoods, very informal spaces that people can just pop into and get advice about health issues that matter to them, such as understanding their risk of diseases like cancer, diabetes and heart disease, but also if they have questions about COVID or flu vaccinations or their mental health, they're able to do that. And with the Health and Wellbeing Days that we've offered, it's really the opportunity for our residents to drop in and have the chance to speak to a range of health professionals, again, in a really informal way that brings people together. And having music, food, family activities at these events has kept things really fun. So people don't feel under pressure or feel they're being told off for not seeking advice sooner. People can just relax. They meet health professionals with similar backgrounds, and they can talk and they can ask questions and they can get their health checked.
I'm just thinking about the Wellbeing Day, because then it means you're gonna do a healthy version of jollof rice, and I don't know how that's possible without oil. You got all these healthy options out there, so and people are like, what are you doing this to us? You know what I mean? But I can imagine everyone's having a great time, and I think this can be modeled in a lot of areas around the country. I'm concerned about, sometimes we're scared because we look at the struggle when people got cancer. We look at a struggle when you got diabetes, and we almost don't want to admit it, but we don't realize that the early intervention stops it from going any further. But we're scared of the treatments, we're scared of certain things, and we sometimes want somebody that looks like you to sit down with you. And I think sometimes with our community, people look at us and go, why do you demand that? Do you find that a lot? Because we just need that comfort of talking to somebody that, I know our kinfolk.
Absolutely. These events are co-designed with the community, so it's really responding to some of the issues that they've highlighted, and we bring together a whole range of partners from public health, our local NHS, the local authority, as well as national organisations and health charities, local religious leaders. And as you say, most of them are Black, and people do feel comfortable being able to have conversations with them, even on really difficult, tricky topics, because they feel that they understand the context in which they live in. I mean, you talked about jollof rice and healthy jollof rice, and even just your diet and how food plays a significant part in our lives as Black people, and someone just really understanding that actually, if you've got to change your diet, it's going to have a huge impact on your life. Because all these family get-togethers actually just talking about food. We also actually have a specifically designed recipe book promoting healthy eating for the African and Caribbean communities. So that's something we've also produced locally to support our community.
So you got healthy coleslaw in there?
Well, there are ways of making coleslaw healthy.
Okay, can I still add sugar in at the end? And it's scary, our diets are not for this country. And I always really emphasize this to people, from an Afro-Caribbean community, our diets were really built around us basically slaving away every day with not much money and just having flour and just chuck it into, it was about just stuffing up our belly just to get through the day. And it was built for different environments, but now we're in a different environment here. The food is becoming a problem. Our grandpas and our dads suffered in silence and died, and no one told people what they died from. But a lot of them died from prostate cancer, never said nothing. A lot of them had struggles because of diabetes and different things, but they never told nobody. They just died in silence and never passed that knowledge. And we now need to start peer mentoring and actually pass on information to the next generation so they can see better practices for our health. You mentioned that COVID highlighted mistrust of the health system, and GPs. Is your passion in this based upon your personal experience, negative experiences, or is this about you seeing positive experiences? Is your personal journey part of your passion in this area?
So I guess I'm part of the system, and we have many Black people who are part of the system. We often talk about mistrust with the health service, but actually we also have members of our Black community who are part of the service. And I think it's really important that we can bring in both our understanding of our culture, our background into our professional lives and influence how we do things, particularly in areas where we see inequalities translates into really kind of poor health outcomes and early deaths of people. So we know, for instance, people from the Black community have higher levels of deaths from hypertension and stroke, and they get stroke at a younger age.
Wow.
Diabetes in Black groups is up to 3 times higher than the white population, and we have more deaths from diabetes. And our men, we talked about prostate cancer, they're 3 times more likely to develop prostate cancer than white men of the same age. And really, it's making sure that we all have the same kind of opportunities to access the support we need and to get the right support that we need. But we also have a role in making sure that we're looking after ourselves well, and where there are opportunities to get support like cancer screening, like vaccinations, that we take these up. Because these are all there to protect us and to help us either pick up early diagnosis of things that might be happening, or actually a recognition of the level of risk. And so people are much more aware of the risk of certain conditions and can actually delay onset if they start taking on and adopting some healthier lifestyle behaviours. So it's a way of really engaging with our community, recognising that for various reasons, both in terms of the way the health service has been developed, which has been very much for the broader population and often doesn't necessarily recognise or is sensitive enough to respond to some of our local needs, that this is the opportunity for people to engage with us, highlight those as well. And the work we've been doing around the health and wellbeing days and the community health and wellbeing hub is really to act as the bridge between the community and our health services. Is to say the health services are there for you as well, and you are valued, and you are eligible to get the best out of the services that are out there. So also it's making people aware of what's there for them.
No, that's absolutely excellent. Now, there's 2 little mini questions I want to ask you before we close off, because this is absolutely fantastic. We do formulate a massive part of the NHS for the past X amount of years since it started, and so it's great to see them actually there is investment into trying to wake us up in this sort of area. Now, I'm based in Birmingham, as you can tell from my beautiful tones. Are you looking to roll this out around the country type projects? Or there is projects in the Birmingham going on that we don't know about? I feel this is needed in areas to how do we bring a wellbeing day tour around the country into Black marginalised communities around the country?
So absolutely. So we're working with our national public health colleagues, our national NHS colleagues, to share the learning from Lambeth. It is something that we've been working on for just over a year now, in actually being really intentional in engaging with our Black community around their health and well-being. And I think that there are areas that actually are doing similar things across the country, and I think we're just trying to really learn and bring things together, and certainly, sharing our learning is something that we've been doing. I mean, part of coming today as well is really to kind of talk about it and for people to be aware that their local area there may be similar initiatives, but certainly in Lambeth we've been really keen to really try this out in a different way, and we are beginning to see successes. The community hubs that I mentioned, we have one in the barber shop. We have yes,
it's a good space,
barber shop. In fact, just recently we were able to help somebody who actually was walking past the barber shop, and we encouraged them to come in to have their blood pressure checked. And as they were sitting down, noticed that their face was drooping slightly on one side, measured their blood pressure. It was through the roof, and we had to call an ambulance. So it's just, actually being there in the community. We also have hubs in our community food shop, which is a shop that provides food at quite low cost for those on low income.
Oh, brilliant. Yeah.
And people come in to get their food, but we are able to talk to them about their health as well, and they have really good relationship with the team. So we're partnering with the Ascension Trust Beacon Project, who you may be aware have done work around street pastors. So they're very familiar with working with the community. Usually the team will consist of healthcare professionals, and ambassadors and mental health outreach worker. And it's really just taking that holistic approach to support people. But certainly we are very keen to continue to share our learning, both for us and for the community as well, because I think it's a two-way thing that we are benefiting from really understanding and being able to provide the right kind of service to our community. But our community as well are benefiting from actually recognising what we can offer them and spreading the word within the community as well. So one day, somebody comes in, and then the next week they bring their whole family with them.
Yeah.
They recognise the importance of looking after their health.
It's absolutely fantastic, and again, it makes me humbles me to we're great to comment about the misservice of the NHS, but let's celebrate the great service that you're doing at saving lives right now. One thing, I spoke to a pharmacist in part of this series, and he was saying that people don't realise that they can just get the blood pressure checked by just going into a pharmacist. And I'm like, I never knew that. And then I said to my friend that, and he goes, of course I know that, but I didn't know that. Why did no one say this? And it brings me to almost tears. Not only old, but young people are dying because of blood pressure. We're not checking these little things that you can get things. I've known somebody who's had a catastrophic stroke. It's taking years to rehabilitate. And I remember he never used to eat too healthy, but it looked good and he worked hard. But as soon as he stopped doing the physical working, he carried on eating the bad way. This is really, really important to have these conversations and have this space. So you got Lambeth, so you got this special well-being day. Is it the day once a year? Is it or is it something you do monthly and weekly in the community? How does it work? Or you have a smaller, you have continual projects going on, and then you have a big day in the summer, and then you continue working the smaller projects. You make people aware. Is it like that? How's the model work?
Absolutely. So we've had two. We've one last year, one this year, and actually the events are really just to engage the community, make them aware, give them the opportunity, and then a lot of the hard work happens in between. That's good. Yeah. The health event, where we have these local community hubs that people can go to on a regular basis. But also, actually, the health event provides, just as you were saying, information about what's available to people anyway. So it goes beyond just the community hubs that we have.
Brilliant.
But you're absolutely right. Our pharmacists can do blood pressure checks for people. There are things people can be doing on their own. They don't, we don't all need to be seeing a doctor for everything. There are things in which we can do, or we can, speak to our pharmacists, or we can go online. There's lots of information online as well. So, and some, not just generic information. There's some tailored information online that we can direct people to. So it's also sharing and raising awareness of what's there. Some people are not registered with a GP, so we also kind of help them to be able to do that. So it's a whole range of things that happen on that particular day. But as I said, during the year, there are other small events that we do, as well as the hubs. The momentum going in terms of also developing that relationship, because it is all around relationship building.
True.
It's supporting people who may have certain views. We know that some people have views about the COVID vaccine, for instance, but it's really being able to have that open conversation and continuing conversation.
Good.
Because I know, for instance, we saw that big gap start when COVID vaccinations were being rolled out. There were more people who were less confident, and then as time went on, that changed slightly. But it's just the opportunity that there's somebody to talk to. You can be open, non-judgmental, and people from your same kind of cultural background. So very much is to say we're there, we care for you. It's not just having a jab in your arm that we're concerned about. We're concerned about the whole you.
Yeah. Oh, this sounds like heaven, guys. I need to move to Lambeth. You know what I'm saying? And be with my community down there, because obviously they got it unlocked, man. I can go to the barber shop and they say, yo, brethren, fix me up with a fade. You know what I mean? Check out my blood pressure. You know what I mean? Yo, check out the local recipe. You got steamed yam and banana. That's great, man. I'm based in the studios, is based just on the edge of Handsworth. So that's the area that we kind of need something like that, 100%. But no, all I have to do is salute NHS. Bimpe, absolutely, Bimpe, brilliant stuff. What you're doing here. I definitely encourage you. We'll put links to the project within the description on this. If you're listening to this through YouTube, because we need to direct people to the project that you're doing, and I'm sure you guys are happy to, like I said, hit the information. If you do work for the NHS and you want a flagship something in your NHS, you got somebody who's part of the NHS that you can reach out to, and I can encourage staff of the NHS. Yeah, you see in your community, we do Slater. How we feel about the NHS, but at the same time, just a little push, a little networking between the staff. Everybody's got relatives that work for the NHS. A lot of conversations, communities as a collective makes a massive difference and saves lives. It's painful. It must be painful to see people ignorant and people die because of a lack of knowledge. We can nothing but encourage projects like this in the area, and the Lambeth area is spoilt. Because it is, but you just keep on spoiling them because it's important.
I think I've covered most of it. I think just really for people to recognise that the NHS is there for everybody. We are now going into autumn. There are calls for things like having your COVID booster and your flu vaccinations. So, if you've got any concerns, speak to a health professional about that. But all these are really important, particularly if you've got an underlying condition, really important that you get protected. But also, we know that, healthcare hasn't necessarily been accessed in a regular way since COVID. It's important that when you do get invited, either for your screening, that you do go, or for your regular checkups, if you've got a long-term condition. And if you're worried about anything, certainly just don't hold back. It's really important that you seek help if you're concerned about anything.
Brilliant. Wow. Thank you for that. Thank you. I'm taking a lot of information, guys. I'm gonna be a NHS professional. I'll be probably a grade 4 NHS staff by the time I finish all this information I'm getting, you know. So I'm talking like I'm an NHS staff here. But thanks again for your time, sis, and we do appreciate your time and efforts. And guys, all the descriptions there, and I appreciate that. Thanks again. You're here, Roger, alongside Bimpe. Okay, Bimpe. Okay. Yes, he should. And we're here celebrating who we are, and we want to really celebrate the fact that basically we want to encourage us to expand our lives by just looking after ourselves and taking care of our well-being, man. That's what we're encouraging. Thank you very much. This is Roger here.
Hey, this is your Bishop. This is your Bishop from Rock Solid. Thank you so much for watching us on YouTube. Thank you so much for clicking and subscribing, and also sending these videos to other people as well. We are so hungry to get your support. So remember, check us out on our website, and also check us out on Insta, and wherever you want to find us on Spotify. You can play us all day as well. And just make sure that you are supporting this channel, that we are developing our agenda towards music of black origin, and that is gospel music with a message. So please walk with us on this journey. Bye now.